The labor process, it is divided into three stages. The first stage, it starts from the onset of true labor pain and ends with full dilation of cervix. In other words, it is known as cervical stage of labor. Its average duration is 12 hours in primigravida and 6 hours in multipara. So in the stage 1, the cervix is relaxed and causing to dilate and thin out, and it is the person is ready for delivery. That is the first stage. It is known as the cervical stage. There will be full dilation of the cervix occurs. Second stage, it starts from full dilation of the cervix, not from the rupture of membrane, and ends with the expulsion of fetus from the birth canal. So the second stage, there will be full dilation of cervix and expulsion of the fetus. And it has two phases. First one, propulsive phase. Second one, expulsive phase. Propulsive phase, it starts from full dilation up to the descent of the presenting part to the pelvic floor. Propulsive phase means it starts from full dilation up to the descent of presenting part to the pelvic floor. Expulsive phase is distinguished by maternal bearing down efforts and ends with delivery of the baby. Its average duration is 2 hours in primigravida, 30 minutes in multipara. So in second stage, uterine contraction increase in strength and the infant is delivered. So that is the second stage. In third stage, it begins after expulsion of the fetus and ends with expulsion of the placenta and membrane. Its average duration is about 50 minutes in both primigravida and multipara. The duration is reduced to 5 minutes in active management. So stage 3 means placenta is expelled. Next stage, that is fourth stage, it is not included normally. Fourth stage, it is the stage of observation at least 1 hour after the expulsion of placenta and membrane. During this period, general condition of the patient and behavior of the uterus is carefully monitored. So that is the stages of labor. First stage, cervical stage. Second stage, delivery stage. Third stage, placental expulsion stage. And fourth stage is the observation stage. During the third stage of labor, placenta and membrane will be delivered. So this time, the fundus is palpable below the umbilicus and fundus feels broad as the placenta is still in the upper segment. But in case of placental separation, there will be some signs, and the signs are there will be a gush of blood from the vagina, umbilical cord will be lengthening, and the uterus will be firm and globular, and uterus rise anteriorly. And the placental separation should be done within 30 minutes of delivery of newborn. So the signs of placental separation, there will be gush of blood, cord lengthening, globular or firm uterus, then uterus rise anteriorly. There are two methods for the placental separation. First one, central separation or Schul's method. Second one, marginal separation or the Matthews-Duncan method. So in case of central separation or Schul's method, there will be detachment of placenta from its uterine segment, starts at the center, resulting in opening up of few uterine sinuses and accumulation of blood behind the placenta. That means there will be a retroplacental hematoma will be present in case of central separation. With the increasing contraction, more and more detachment occurs, facilitated by weight of the placenta and retroplacental blood. And the placenta will be detached. So that is the central separation or Schul's method. Here the separation starts from the center and the retroplacental hematoma and the weight of the placenta and the contraction that will helps to detachment of placenta. Next is the marginal separation or Matthews-Duncan method. Here, separation starts at the margin as it is mostly unsupported. With progressive uterine contraction, more and more areas of the placenta get separated. Marginal separation is more frequent. So, marginal separation or Matthews-Duncan method, here the separation starts from the margin, and during the progressive uterine contraction, the placenta is gradually detached and separated. And stripping or separation of membranes also done with this placental membrane, placental separation. The expulsion of placenta, it is done by voluntary contraction of the abdominal muscles, that is bearing down efforts, or by manual method. So expulsion, it is done by manual method or by bearing down efforts. So that is regarding the third stage of labor. During the third stage of labor, there will be signs of placental separation, and placenta can be separated by two methods, central separation and the Matthews-Duncan method. And the placental expulsion is done by bearing down efforts or by manual procedure. Thank you.